Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you'll be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free clinical hypnosis training classes with several free ebooks. Let's keep seeing nicotine replacement therapies and STS, Part 2. Nicotine inhaler. The nicotine inhaler is held between the fingers and a puff is inhaled. When you inhale, the inhaler converts the nicotine into vapor and is absorbed in the mouth and throat. How to use the nicotine inhaler. Hold the inhaler between your fingers and take a puff. When you inhale or snort through the mouthpiece, the nicotine turns into vapor and it's absorbed in the mouth and throat. The inhaler is preferred by smokers who need to have something to replace a cigarette, both in their hand and in their mouth. At first, you should use the inhaler longer and more often to help you control the urge to smoke a cigarette again. Compared to a cigarette, the inhaler delivers less nicotine per puff. The inhaler uses nicotine cartridges that provide about 20 minutes of puffs or about 80 deep puffs or about 300 light puffs. Your doctor can adjust the number of inhalers cartridges you will use for the first few weeks. Most of the people who were successful in research use between 6 and 16 cartridges a day. The greatest effect was obtained with frequent and continuous inhalations 20 minutes. Side effects can occur such as throat and mouth irritation, coughing, and stomach upset. When your body adjusts to being smoke-free, your doctor will tell you whether you should stop using the inhaler or slowly reduce its use. Do not use more than 16 cartridges each day unless your doctor tells you to. The recommended course of treatment is 3 months, and if necessary, a gradual reduction is made over the 6 to 12 weeks. Total treatment should not exceed 6 months. Refer to the package insert for any support programs the manufacturer may offer. Some side effects that may occur with the nicotine inhaler: coughing, throat irritation, stomach problems. Nicotine lozenges. This is the latest in nicotine replacement therapy on the market. Like nicotine gum, lozenges come into 2 strengths, 2 and 4 milligrams. Smokers decide which dosage is right for them, depending on how long it usually takes them to light up their first cigarette in the morning. How to use nicotine lozenges. The manufacturers of these lozenges recommend using them as part of a 12-week program. The recommended dose is 1 lozenge every 1 to 2 hours for 6 weeks. Then 1 lozenge every 2 to 4 hours for 7 to 9 weeks. And finally, 1 lozenge every 4 to 8 hours for 10 to 12 weeks. You must stop smoking completely when you start the pill therapy. Do not eat or drink 15 minutes before using the lozenge. Some drinks may reduce the effectiveness. Suck on the lozenge until it dissolves. Do not bite or chew the lozenge like a piece of candy or swallow it. Do not use more than 5 pills in 6 hours or more than 20 pills total per day. Stop using the pills after 12 weeks. If after this time you feel you still need to use it, consult your doctor. Do not use nicotine lozenges if you continue to smoke, chewing tobacco, or any other nicotine-containing product. Some side effects that may occur with nicotine lozenges: trouble sleeping, nausea, hiccups, coughing, heartburn, headache, flatulence, gas. How nicotine replacement therapy works. Nicotine substitutes treat difficult withdrawal symptoms and craving. The only reason why 70 to 90% of smokers express that they cannot quit. When a nicotine substitute is used, withdrawal symptoms are reduced. Although a large number of smokers are able to quit without nicotine replacement, most smokers do not succeed on the first attempt. In fact, smokers usually need to make several attempts before they are able to quit for good. Lack of success is often related to the onset of withdrawal symptoms. Smokers who want to quit have a better chance of quitting when these symptoms are reduced with the use of nicotine replacement therapy. Because NRT treats only the physical aspects of addiction, it is not expected to be used as the sole treatment for nicotine replacement therapy. It is not expected to be used as the sole method to help the smoker. It should be combined with other methods that address the psychological component. For example, deepening the ability to relax and calm down, strengthening self-confidence, increasing self-esteem, self-control, etc. Several studies have shown that when nicotine replacement is combined with behavior change counseling, you can double your chances of quitting. The US Agency for Healthcare Research and Quality, AHRQ, Clinical Practice Guideline on Smoking Cessation recommends nicotine replacement therapy for all smokers, except for pregnant women and people with heart or circulatory system disease. If a physician recommends nicotine replacement, under these circumstances, the benefits of quitting must outweigh the potential health risk. Pregnant smokers and smokers with heart disease should consult their physician before using OTC nicotine replacement therapy. Which nicotine replacement therapy is right for me? There is no evidence that one type of nicotine replacement is significantly better than another. When choosing which type of nicotine replacement to use, discuss which method will best suit your lifestyle and smoking pattern. Important issues to consider. Nicotine gum, lozenges, and inhalers are oral substitutes that allow you to manage your dosage to help you better control cravings. Nicotine nasal spray works quickly when you need it. Nicotine inhalers allow you to stimulate cigarette use. They are held in your hand and puffed like cigarettes. Nicotine patches are convenient and only need to be applied once a day. Both inhalers and nasal sprays require a prescription. Using the nicotine patch with the less active products such as gum, lozenges, spray, or inhaler is another method of nicotine replacement therapy. The idea is to provide a steady dose of nicotine with the patch and use one of the lesser acting products when cravings arise. The few studies that have been done with the combination of nicotine replacement therapy have found that it may be slightly better than one product alone. However, more research is needed to prove this and to find safe and effective doses. If you're interested in learning more about clinical hypnosis, watch our next video, Smoking Cessation Drugs. Remember to study the description of this video where you can find a link to free training classes on clinical hypnosis, with share free ebooks as well. If you have questions, ask them in the comments area. On this topic and many others, we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.